Sphere. The Humanitarian Charter and Minimum Standards. Part 3. Food security and nutrition. In this part we'll explain the essential concepts in food security and nutrition. 1. Food security and nutrition assessments. 2. Management of malnutrition. 3. Micronutrient deficiencies. 4. Infant and young child feeding. 5. Food security. 6. Food assistance. 7. Livelihoods. Essential concepts in food security and nutrition. 1. Everyone has the right to be free from hunger and to have adequate food. The standards are grounded in the beliefs, principles, duties, and rights declared in the Humanitarian Charter. These include the right to life with dignity, the right to protection and security, and the right to receive humanitarian assistance on the basis of need. The causes of undernutrition are complex. The immediate causes of undernutrition are inadequate food intake and repeated disease. The underlying causes are household food insecurity, poor feeding and care practices, unhealthy household environment and inadequate health care. Food and nutrition responses should work with WASH, shelter and settlement, and health care responses in a coordinated approach. Control of the underlying causes will prevent and reduce undernutrition. Food security and nutrition responses should contribute to protecting and developing these assets, and therefore supporting different livelihood strategies. Working in urban areas brings specific challenges. Increasing urbanization is creating new challenges for the food security and nutrition sector. Urban environments potentially offer increased employment and income-generating opportunities. However, as urban populations increase, demand for housing and services in those areas also increases. In many cases, existing land use planning policies and strategies cannot meet the unanticipated demand. Overcrowding, air pollution, poor waste management and lack of sanitation facilities in slums increase the chance of contracting acute illnesses. This reduces people's ability to take advantage of livelihoods opportunities and often triggers the underlying causes of undernutrition. Some groups are particularly vulnerable to undernutrition. Developing an appropriate food response requires a full understanding of the unique nutritional needs of pregnant and breastfeeding women, infants and children, older people and persons with disabilities. Improving food security at the household level also requires an understanding of different roles. Women, for instance, often play a greater role in the planning and preparation of food for their households. It is important to disaggregate data by sex, age, and disability at a minimum. Food security and nutrition interventions may determine nutrition and health status in the short term, and survival and well-being in the long term. These minimum standards should not be applied in isolation. The right to adequate food is linked to the rights to water and sanitation, health, and shelter. Progress in achieving the sphere minimum standards in one area influences progress in other areas. Therefore, an effective response requires close coordination and collaboration with other sectors, local authorities, and other responding agencies. This helps ensure that needs are met, that efforts are not duplicated, and that the quality of food security and nutrition responses is optimized. Cross-references throughout the handbook suggest potential linkages. 6. International law specifically protects the right to adequate food. The right to be free from hunger and to have adequate food is protected by international law. It requires physical and economic access to adequate food at all times. States are obliged to ensure this right when individuals or groups, including refugees and internally displaced persons, are unable to access adequate food, including in crises. Seven. Links to the protection principles and core humanitarian standard. Food and nutrition assistance has the potential to lead to serious rights violations if it is misused, particularly in exploitation or abuse of program participants. Programs must be designed with the affected population and implemented in ways that contribute to their safety, dignity, and integrity. Proper management and strong oversight of staff and resources are required, along with strict adherence and enforcement of a code of conduct for all those involved in delivering assistance programs. Establish clear feedback mechanisms with the affected population and respond quickly to any concerns. Food security and nutrition standards. 1. Food security and nutrition assessments. Food security and nutrition assessments are required throughout a crisis. Joint food security and nutrition assessments can increase cost effectiveness and link nutrition to food security programming. Assessments should adhere to widely accepted principles, use internationally accepted methods, and be impartial, representative, and well coordinated between humanitarian organizations and governments. Assessments must be complementary, consistent, and comparable. Food security and nutrition assessments standard 1.1. Food security assessment. Where people are at risk of food insecurity, assessments are conducted to determine the degree and extent of food insecurity, identify those most affected and define the most appropriate response. Key actions. 1. Collect and analyze information on food security at the initial stage and during the crisis. 2. Analyze the impact of food security on the nutritional status of the affected population. 3. Identify possible responses that can help to save lives and protect and promote livelihoods. 4. Analyze available cooking resources and methods, including the type of stove and fuel and availability of pots and utensils. Food security and nutrition assessments standard 1.2. Nutrition assessment. Nutrition assessments use accepted methods to identify the type, degree, and extent of undernutrition, those most at risk, and the appropriate response. Key actions. 1. Compile pre-crisis information and conduct initial assessments to establish the nature and severity of the nutrition situation. 2. Conduct rapid mid-upper arm circumference (MUAC) screening and infant and young child feeding in emergencies (IYCFE) assessments to assess the nutritional situation at the onset of the crisis. 3. Identify groups that have the greatest need for nutritional support. 4. Determine an appropriate response based on an understanding of the context and the emergency. (2) Management of malnutrition. The prevention and treatment of malnutrition are both important considerations in humanitarian crises. Chronic malnutrition can be prevented. but there is limited evidence that it can be reversed or treated. On the other hand, acute malnutrition, which may be triggered during a crisis, can be prevented and treated with the right nutrition responses. Management of Malnutrition Standard 2.1. Moderate acute malnutrition. Moderate acute malnutrition is prevented and managed. Key actions. 1. Establish clearly defined and agreed strategies, objectives, and criteria for setup and closure of interventions from the outset of the program. 2. Maximize access to coverage of moderate acute malnutrition interventions through community engagement and involvement from the beginning. 3. Establish admission and discharge protocols, based on nationally and internationally accepted anthropometric criteria. 4. Link the management of moderate acute malnutrition to the management of severe acute malnutrition and to existing health services. 5. Provide take-home dry or suitable ready-to-use supplementary food rations unless there is a clear rationale for on-site feeding. 6. Emphasize protecting, supporting, and promoting breastfeeding, complementary feeding and hygiene. Management of Malnutrition Standard 2.2. Severe acute malnutrition. Severe acute malnutrition is treated. Key actions. 1. Establish clearly defined and agreed strategies, objectives, and criteria for setup and closure of interventions from the outset of the program. 2. Include inpatient care, outpatient care, referral, and community mobilization components in the management of severe acute malnutrition. 3. Provide nutrition and health care according to nationally and internationally recognized guidelines for the management of severe acute malnutrition. 4. Establish discharge criteria that include anthropometric and other indices. 5. Investigate and act on causes of default and non-response, or an increase in deaths. 6. Protect, support and promote breastfeeding, complementary feeding, hygiene promotion, and good mother and child interaction. Three. Micronutrient deficiencies. Micronutrient deficiencies are a constraint to socio-economic development in many countries. They have a great impact on people's health, learning ability, and productivity. These deficiencies contribute to a vicious cycle of malnutrition, underdevelopment, and poverty, affecting already underprivileged groups. Micronutrient deficiencies are difficult to identify in many contexts. While clinical signs of severe deficiencies may be easy to diagnose, the greater burden on the health and survival of populations may be subclinical deficiencies. Micronutrient deficiencies Standard 3.1. Micronutrient deficiencies. Micronutrient deficiencies are corrected. Key actions. 1. Collect information on the pre-crisis situation to determine the most common micronutrient deficiencies. 2. Train health staff in identifying and treating micronutrient deficiencies. 3. Establish procedures to respond to micronutrient deficiency risks. 4. Link micronutrient responses with public health responses to reduce diseases commonly associated with crises, such as vitamin A to manage measles and zinc to manage diarrhea. For infant and young child feeding. Appropriate and timely support of infant and young child feeding in emergencies saves lives and protects children's nutrition, health, and development. Inappropriate infant and young child feeding practices increase vulnerability to undernutrition, disease and death, and undermine maternal health. Crises increase those risks. Priority interventions include breastfeeding protection and support, appropriate and safe complementary feeding, and management of artificial feeding for infants with no possibility to breastfeed. Infant and Young Child Feeding Standard 4.1. Policy Guidance and Coordination. Policy guidance and coordination ensure safe, timely, and appropriate infant and young child feeding. Key actions. 1. Establish an IYCFE coordination authority within the crisis coordination mechanism, and ensure collaboration across sectors. 2. Include the specifications of the operational guidance in relevant national and humanitarian organization policy guidance on preparedness. 3. Support strong, harmonized, timely communication on IYCFE at all response levels. 4. Avoid accepting or soliciting donations of breast milk substitutes, other liquid milk products, feeding bottles, and teats. Infant and Young Child Feeding Standard 4.2. Multi-sectoral support to infant and young child feeding in emergencies. Mothers and caregivers of infants and young children have access to timely and appropriate feeding support that minimizes risks, is culturally sensitive and optimizes nutrition, health, and survival outcomes. Key actions. 1. Priorities pregnant and breastfeeding women for access to food, cash, or voucher transfers and other supportive interventions. 2. Provide access to skilled breastfeeding counseling for pregnant and breastfeeding mothers. 3. Target mothers of all newborns with support for early initiation of exclusive breastfeeding. 4. Provide appropriate breast milk substitutes, feeding equipment and associated support to mothers and caregivers whose infants require artificial feeding. 5. Support timely, safe, adequate, and appropriate complementary food support. 6. Provide feeding support to particularly vulnerable infants and young children. 7. Provide micronutrient supplements as necessary. 5. Food security. In a humanitarian crisis, food security responses should aim to meet short-term needs and reduce the need for the affected population to adopt potentially damaging coping strategies. Over time, responses should protect and restore livelihoods, stabilize or create employment opportunities and contribute to restoring longer-term food security. Household food insecurity is one of 4 underlying causes of undernutrition, along with poor feeding and care practices, an unhealthy household environment and inadequate health care. Food Security Standard 5.1. General Food Security. People receive food assistance that ensures their survival, upholds their dignity, prevents the erosion of their assets and builds resilience. Key actions. 1. Based on food security assessment data, design the response to meet immediate needs, and consider measures to support, protect, promote, and restore food security. 2. Develop transition and exit strategies for all food security programs as early as possible. 3. Ensure that people receiving assistance have access to the necessary knowledge, skills, and services to cope and support their livelihoods. 4. Protect, preserve, and restore the natural environment from further degradation. 5. Monitor the level of acceptance of and access to humanitarian food security interventions by different groups and individuals. 6. Ensure that people receiving food assistance are consulted on the design of the response and are treated with respect and dignity. Six. Food assistance. Food assistance is required when the quality and quantity of available food or access to food is not sufficient to prevent excessive mortality, morbidity, or malnutrition. It includes humanitarian responses that improve food availability and access, nutrition awareness, and feeding practices. Such responses should also protect and strengthen the livelihoods of affected people. Response options include in-kind food, cash-based assistance, support for production and market support. While meeting immediate needs is a priority in the initial stages of a crisis, responses should preserve and protect assets, help to recover assets lost through crises and increase resilience to future threats. Food Assistance Standard 6.1. General Nutrition Requirements. The basic nutritional needs of the affected people, including the most vulnerable, are met. Key actions. 1. Measure the levels of access to adequate quantity and the quality of food. 2. Design food and cash-based assistance to meet the standard initial planning requirements for energy, protein, fat, and micronutrients. 3. Protect, promote, and support affected people's access to nutritious foods and nutritional support. Food Assistance Standard 6.2. Food quality, appropriateness, and acceptability. The food items provided are of appropriate quality, are acceptable and can be used efficiently and effectively. Key actions. 1. Select foods that conform to the national standards of the host government and other internationally accepted quality standards. 2. Choose appropriate food packaging. 3. Assess access to water, fuel, stoves and food storage facilities. 4. Provide access to adequate milling and processing facilities when whole grain cereal is provided. 5. Transport and store food in appropriate conditions. Food Assistance Standard 6.3. Targeting, distribution and delivery. Food assistance targeting and distribution is responsive, timely, transparent and safe. Key actions. 1. Identify and target food assistance recipients based on need and consultations with appropriate stakeholders. 2. Design food distribution methods or direct cash/voucher delivery mechanisms that are efficient, equitable, secure, safe, accessible and effective. 3. Locate distribution and delivery points where they are accessible, safe, and most convenient for the recipients. 4. Provide recipients with advance details of the distribution plan and schedule, the quality and quantity of the food ration or the cash or voucher value, and what it is intended to cover. Food Assistance Standard 6.4. Food use. Storage, preparation, and consumption of food is safe and appropriate at both household and community levels. Key actions. 1. Protect people receiving assistance from inappropriate food handling or preparation. 2. Consult with and advise people receiving assistance on storage, preparation, cooking, and consumption of food. 3. Ensure that households have safe access to appropriate cooking utensils, fuel-efficient stoves, clean water, and hygiene materials. 4. Ensure that individuals who cannot prepare food or feed themselves have access to caregivers who can support them where possible and appropriate. 5. Monitor how food resources are used within the household. Seven. Livelihoods. People's ability to protect their livelihoods is directly related to their vulnerability to crises. Understanding vulnerabilities before, during and after a crisis makes it easier to provide appropriate assistance, and to identify how communities can rehabilitate and improve their livelihoods. Crises can disrupt many of the factors that people rely on to maintain their livelihoods. People affected by crises may lose their jobs or have to abandon their land or water sources. Assets may also be destroyed, contaminated, or stolen during conflict or natural disasters. Markets may stop functioning. Livelihoods Standard 7.1. Primary production. Primary production mechanisms receive protection and support. Key actions. 1. Provide access to production inputs and/or assets for farmers. 2. Deliver inputs that are locally acceptable, conform to appropriate quality norms and are on time for best seasonal use. 3. Ensure inputs and services do not increase vulnerability for recipients or create conflict within the community. 4. Involve affected men and women equitably in planning, decision-making, implementing and monitoring of primary production responses. 5. Train producers engaged in crop, fishery, aquaculture, forestry and livestock sectors in sustainable production and management practices. 6. Assess the market and stimulate demand for locally produced crops, vegetables, and other agricultural products. Livelihoods Standard 7.2. Income and employment. Women and men receive equal access to appropriate income earning opportunities where income generation and employment are feasible livelihood strategies. Key actions. 1. Base decisions regarding income earning activities on a gender-sensitive market assessment. 2. Choose types of payment, in kind, cash, voucher, food or a combination, based on a participatory analysis. 3. Base the level of payment on the type of work, local rules, objectives for livelihoods restoration and prevailing approved levels of payment in the region. 4. Adopt and maintain inclusive, safe, and secure working environments. 5. Promote partnerships with the private sector and other stakeholders to create sustainable employment opportunities. 6. Choose environmentally sensitive options for income generation whenever possible.